Hello and welcome to our video guide to the VIN Virtual Clinic. In this video series, we will be detailing how to access and use the virtual clinic, as well as showcasing the different patients available. In this episode, we will be going over how to navigate a case. Once you have started a case, the first thing you will see, if enabled, is the guide. This interface element gives you information on how to navigate around the case, providing situation-specific help. Since it's doing the job I am supposed to do in this video, we will disable it for now. After the case has properly started, you will be greeted by the mentor. The mentor is also a source of help for you, but unlike the guide panels, he or she offers feedback on the state of the patient, your drug choices, and provides a narrative for the entire case. If you get more adept in figuring out how the simulation works, he might become too annoying for you. In this case, you can always silence him, and I will show you how to do that in just a bit. Once you have clicked OK on the mentor's greeting message, the simulation will start. Notice that the time passes, as most of our simulations are dynamic, meaning that they will keep on running regardless of your actions. Your patient is on the center of the screen and is responding to the events of the simulation by visibly getting better or worse. If enabled, you can get more information on your patient's vitals from the heart monitor, which updates every simulated time step, showing you important feedback on where your patient is heading. Another source of information is the room trend display, which displays the trend of key parameters over the course of the simulation. You can individually hide or mute these elements by clicking on their appropriate buttons. There are a total of 13 buttons you can use to interact with the simulation, and these buttons are organized in 3 groups: the left vertical menu, the right vertical menu, and the patient menu. The left menu is all about information. The first 4 buttons operate the chart, which has important details for you grouped in 4 categories. The Patient Info tab contains the presentation and in some cases the history of your patient. The Mentor Notes tab contains everything the mentor has said over the simulation, allowing you to review feedback you received. The Results and Treatments button shows the results of every test you have ordered, as well as any treatments you have given. The Trends button shows the trends of certain parameters, including but not limited to what you see on the room trend display. Finally, the Get Help button will summon the mentor, who will provide situation-specific feedback for you to help you decide what to do next. The right menu is about interacting with the program. From top to bottom, the first button is the Full Screen button, which allows you to switch between a smaller screen size and full screen. The next button allows you to pause or resume the simulation, a valuable tool that you won't have in real-life cases. However, it's very helpful here, in case you need to take a break or read into something. The next button mutes all sound or turns it back on. The fourth button will allow you to jump forward in time, allowing you to see the effects of your treatments without having to wait in real time. Finally, the Controls button allows you to turn on or off certain interface elements, as well as enabling or disabling the mentor, or changing the simulation speed. The final set of controls is the Patient menu, which is located underneath the patient and can be focused by clicking on the patient. Under the Evaluate button, you can run diagnostic tests. In some cases, you will need to assess the results of them. Under the Treat button, you can select from drugs or other treatment options. You will need to select the dosage of your drugs before administering though, and you will have all information for that in the Drug Creator panel. If you have trouble calculating in your head, make sure to use our built-in calculator. Finally, you can attempt to discharge the patient, which ends the simulation if the patient is in a dischargeable condition. This button is replaced with the Make Diagnosis button in our hyperadrenocorticism simulator. The case can end in 3 ways: the patient getting cured or diagnosed, the patient dying, or you running out of time. Once any of these events happen, you will get an evaluation on how you did and see your score. You can choose to retry the simulation if you are not satisfied with your score, or you can close the simulation. Thank you very much for watching, and see you in the next video.